Degenerative disc disease is one of the scariest things that a patient can hear inside of a doctor's office. Usually people will get an MRI or an X-ray, and once they meet with the doctor regarding those MRI or X-ray results, that's when the doctor will mention that they've got degenerative disc disease. And one of the reasons it's so scary and frustrating to deal with is because the doctors usually leave their patients hanging on this. They don't have many other solutions besides taking pain medications, getting injections, and potentially a surgery if it's bad enough. But I've got great news for you. It is possible to get back to normal again, to restore your back motion, your mobility, your strength, and to feel great in the mornings when you get up to move around. I'm going to show you the top 5 exercises for degenerative disc disease to get going on feeling normal again. But before I show you those exercises, you need to know that it's a process to heal degenerative disc disease enough to get better. It doesn't happen overnight or even over the course of a few weeks. It can take you more like months or the better part of a year to restore your back to normal again. The exercises here, a few of them, the ones at the beginning, are designed to get you some quicker pain relief, but it's not going to take it away completely. You've got to be on yourself with these exercises, just like I talk about with the reps and sets, so that you can get longer lasting relief and compound that over time. And as these exercises get easier for you, you need to get the next level exercises, which we'll make videos for here on our channel. After these exercises get easy, then it's important to progress these exercises so that you can continue to improve for the long term. We've got a program available called the 28-Day Back Health and Wellness Boost Program. The link is in the description below. And that program is a comprehensive online program that you can access anytime you want and begin a 28-day process for strengthening your core, the muscles that support your back, your hips as well, so that you can have a healthier back as time goes on. Let's get to today's exercises. The first one is called quadruped rocking. Let me show you. You're gonna have to get on the floor or your bed to do this. You're gonna be on your hands and knees just like so. And you can be on your fists or your flat hands, whatever's comfortable for you. I'm gonna do it like this. And then all you gotta do is rock back like a cat or a dog and sit under your haunches. You can stretch here a bit if you like, and then come back up over your hands and just repeat that nice and easy. If you wanna hang here and stretch a bit, you can. If you wanna just go back and forth, that's good. And what this does, it's offloading you because you're not vertical, your head's not above the rest of your body. It takes pressure off your back so that you can take that pressure off the discs in your lower back. And then adding this movement makes the muscles and all the other tissues inside your body, the nerves, ligaments, tendons, all that stuff, it allows it to move in a way that isn't stressful for it. Now, if you've got knee problems, this could be a little aggravating for you. So just move as far as you can back if you can't bend your knees all the way. Or if it hurts to put pressure on a knee, just lean away from that knee so that you can still go back and forth, putting pressure on the other side. And if it just doesn't work for you to be on your knees like this at all, then you can do this standing with your feet on the ground, and you would still lean your hands over a table or a counter or a bed, wherever you feel like you can do this, and do the same motion but with your feet on the ground. After you've done 30 reps, you're gonna do an angry cat exercise. You're in the same position, and what you're gonna do is suck in your abs here and arc your back as high as you can, go up as high as you possibly can, and hold it there for 10 to 20 seconds. You're actively trying to suck in your abs, pull this in, and what that should do is push your back up. So think about pushing your back up as high as you can as well, just like an angry cat would do, and hold it there for that 10 to 20 seconds. And then after the time's up, you can relax. You don't have to sink down necessarily, just come back down to wherever you like to be comfortably. And repeat that 10 times. Suck in your abs real hard, push your back away from the table, or from the floor, wherever you're at. Hold it for about 10 to 20 seconds, and then you can relax and just repeat this 10 times. So it's a good way to turn on your abdominal muscles and get your back to move correctly, to take pressure off that degenerative disc disease in your back. After you've done 10 reps of this, we're gonna do some controlled rotations. Now, you can call this a stretch. I call it a rotation exercise. And the reason is your spine is not designed to twist and rotate very well. It's best designed to bend forward, backwards, go to the sides, and even to be compressed or stretched out. But twisting is the least tolerated motion of the spine, and I'll show you why. If you just, from wherever you're sitting, twist like so, and carefully, don't hurt yourself if you're hurting, and you'll see how far you can go this way or go the other way if you want. Then just like you tightened up your abs on that last angry cat exercise, suck in your abs and kind of arc your back a little bit. You see how I'm slouching? That's what needs to happen. Hold that a bit, 50 to 100%, whatever you feel comfortable doing, and then try to twist again, and you'll see you don't go as far. Your abs are preventing you from twisting as far, and that's good. You want the abs to do that because it protects your spine from worse situations. It protects you from getting more degenerative disc disease. So here's the exercise. You're going to suck in your abs just like you did a second ago, and then twist as far as you can comfortably go. Don't hurt yourself, of course. Don't hang out there too long, and then go the other way. And you're going to go back and forth 30 times, so 15 each direction, holding your abs in the whole time. And I'm subtly slouched here as I do this. If you want to hang out there and stretch, I'm okay with it. You got to judge it and see if it's good for you, if it's okay on your back. If it doesn't feel good on your back, don't stretch there, especially if you have any lingering effects afterwards. You don't want to hang out in a stretch position for your back. The next exercise we'll do after this will actually directly stretch your back, but it's a very controlled motion as well, just like this one. So suck in those abs and twist as far as you can. I'm kind of grabbing my leg to pull me over just a bit further. I like to do that because if you just twist on your own, you may not go as far. You can just get an extra few degrees if you push with your hands, but please do not let go of your ab contraction. It's critical that you hold your abs during this whole exercise. So after you've done 15 rotations each direction, the next we're going to work on a lumbar flexion exercise. Bending over is basically what I'm talking about. So when people bend over, they usually just fold at their hip joint and don't really bend through their back bones. They don't bend their back joints. In fact, I got the skeleton just to show you what I'm talking about here. They bend at their hips down here rather than bending these bones. And these bones don't bend a whole lot, but they should bend some in order to take pressures off the joints in the back and normalize motion in the spine. So what you're going to be doing right now is thinking of bending each bone one at a time as you go through the lower back, especially, in order to get these joints to open up and take pressure off the nerves so you don't have any pinched nerves, and normalize motion in the back. So here's what it looks like. I'm going to stand up. I'm going to stand sideways here so you can see this. And I'm just going to suck in my abs. And as you can see, my upper body wants to slouch a bit. My butt muscles even fire a bit. That's okay. I'm pre-curved, but my abs are set so my back bones and my discs are being protected. Once I do that, let me show you what my head's doing. So once my abs are set, now I'm going to look down. So I'm bending one vertebrae or one bone in the spine at a time, starting with the neck, then into the upper and mid back, and then we'll get to the low back. So abs in, subtle slouch, look down, double chin, start to curl those shoulders down, and then I'm going to reach with my hands, and right about here my lower back starts to feel a little stretched. I'm sucking my abs in pretty darn good, as much as I can. That's the motion, but I'm going to do it in standing. You can do it in seated if you have balance issues or just prefer seated for whatever reason. So abs in, subtle slouch, looking down on my head, bringing those shoulders down. My butt muscles want to fire more to do this. That's okay. And I'm just going to reach down, and I'm not going to go all the way to the ground. I'm going to go just past my knees a bit. I already feel my back muscles stretching, and my abs are working. I feel my abs working pretty hard. And then I'm going to come back up and just unfold. Start with push my hips forward, and then suck in those abs. Continue to suck in those abs and straighten up through the rest of my body up high. I'm going to do 10 reps like this. Well, I want you to do 10 reps like this as I'm going to do it as I'm talking to you a bit. So abs in, look down, start to bend over and fold through the spine. And what I wanted to mention to you is, it's kind of embarrassing, but my skin is folding right here in the front. I'm getting folds right here, and that's good. Everybody folds right there anyway. But I feel it much more intensely when I do this exercise than if I were to just bend over without sucking in my abs. When I suck in my abs, it really pulls everything in here, and so everything's folding on itself. And in case you get some funny sensations, like your organs might actually be, just a little compressed, it shouldn't be anything harmful for you. And you're just going to be there for a moment anyway, nothing that's going to make you worse. But it's a bit of a funny sensation. You can feel your skin folding on itself more than you normally might, and that's okay. And come back up like this, and then straighten up at the end. And my back already just feels more mobile because I've opened it up this way. So the final exercise, it's kind of a posture more so, but it's very, very important. It's abdominal bracing throughout everyday activities. So what you should be doing is basically tightening up your abs. It's a version of what I've been showing you already, but you need to keep this up while you're waking up in the morning, getting up to go to the bathroom, going down the hall to the kitchen, or doing chores around the house, while you head to work, while you're at work, anytime that you're sitting, standing, or walking, you should be doing this. And it's really simple. You've already been practicing it. All you've got to do is suck in those abs. But let's talk percentages for a moment. If on these exercises you did 90 to 100% intensity of what you could do maximally, I want you to back off to just 25%. So instead of 100% like this, I'm going to back off to about 25%. I feel some tension right there. I can still talk, I can breathe just fine, I can move just fine, but my abs are just a little bit tight. Now this isn't going to last long, especially if you haven't been doing this for a while. You're probably going to get tired or forget pretty quick here. And the trick with this exercise is to challenge yourself to do it for several minutes at a time. See if you can go 5 minutes or 10 minutes and work your way up beyond that, 20 or 30 minutes. What you should do is find that activity that you're going to do next. Like say you're going to do the laundry or something, or go get the mail from the mailbox, or go to a grocery store. Challenge yourself to hold your abs as best you can during that time. Or maybe a drive, because you should do this while you're driving too. The drive from here to your next destination, holding your abs. And inevitably you're going to forget and just be on yourself. You need to have some reminder system to be on yourself about this throughout the day. Everybody's got smartwatches these days. You can use that, or your phone. You can put an alarm on there. Have one go off every 30 minutes, every hour, just to remind yourself to suck in your abs a bit and hold it for 25%, and then go on with your day. I can't stress how important this exercise is for immediate pain relief. Most of the time, I'd say 7 out of 10 people that come in with back problems of all sorts, especially degenerative disc disease, because they're getting so much compression through the spine, when they fire their abs like this and learn how to do it as they do their daily activities, they can get a dramatic reduction for a long time. As long as they're firing their abs, they can get a dramatic reduction on their back problem. So trust me, these exercises over here, it's a little more self-gratifying because you can count the reps, you can kind of focus on them for a finite amount of time, and then you're done with it and you forget about it. But if you go back to the normal posture that you've been in, you're not really firing your abs, then you're going to harm your back. And the reason for that is because if you're not using your abs to balance and stabilize yourself whenever you're sitting or standing, you got to be using something. And usually it's those back muscles on the back of the spine right here. Those are the ones that people get tired in, that they feel achy in. Those are the ones that are working. They're usually really hard and dense, or kind of big, even on somebody who's not that big. Those muscles, their job is to extend the spine, but also compress the spine. And so they add a lot of pressure. And so if you don't fire your abs to counteract the pressure from those back muscles, you're going to be making your back situation worse. That degenerative disc disease is just going to progress. But if you can fire your abs throughout the day, like I just said, then you have an excellent shot at halting that degenerative disc disease and even beginning to reverse it for the long term, so that you can avoid surgery, avoid pills, and avoid having injections. Guys, I hope this video was helpful for you. If it was, please give it a thumbs up. And don't forget to subscribe to our videos so that you don't miss out on any of the helpful videos that we upload every week. Thanks so much and have a wonderful day.